Hello, everyone. I'd like to welcome you to today's activity entitled The Impact of Generalized Pustular Psoriasis on Our Patients. My name is Leanne Ponch, and I am a dermatology nurse practitioner practicing at Doc's Dermatology in Cincinnati, Ohio. I am thrilled to be joined today by Dale Reisner. He is a current patient with generalized pustular psoriasis and he lives in Yankton, South Dakota. In this first part of the activity, I'll be talking with Dale about the keys to a successful patient-provider relationship. And later, in the second part of this activity, another patient and provider team will be talking about the impact of generalized pustular psoriasis on the patient quality of life. We'd like to thank Behringer Ingelheim for providing an unrestricted educational grant to help support this education. And now let's get started. Dale, could you please tell us about your general medical history? When did you start noticing that something was wrong with your skin? And then in the course of your disease, have there been any specific notable periods that you think would be beneficial for us to be aware of?
Sure. My psoriasis started back in 1978, 79 when I was 16, 17 years old. And when I started, it was just called psoriasis. It wasn't, that's all there was. They didn't have any other names for it. During the course of my life, I've gone through many, many major flares. It wasn't until 2005 that I was actually diagnosed with general pustular psoriasis, and it was kind of a double-edged sword. It was nice to know what I had, but yet I didn't really know what I had because there wasn't much information on it either. So, I've just kind of gone through life dealing with it the way that I deal with stuff. I always try to look on the bright side. Like I said just a few minutes ago, I've had some major flares. I've actually had a flare that lasted 12 years from about 1993 till 2005. And that, like I said, that was when I got diagnosed with GPP. And I've been living with it ever since.
What an incredible story and a wealth of information for us as providers. I really have some very key questions for you. So first of all, just to give us one more piece of sort of what it's like to be in your life, when was your condition at its worst?
The worst I've ever been was from 1993 to 2005. I was covered from head to toe, from the bottom of my feet to the top of my head. Everything had psoriasis on it, general pustular psoriasis on it, and that was the worst time. And I had been visiting. I'd probably been to by that time. I'd probably been to 7, 8 doctors, dermatologists from South Dakota all the way to California. I've been all over different states. I've been to Colorado, Nebraska, Iowa, South Dakota, California to see doctors to try to get this under control. And even any of all those times, I never did find out what it was until 2005 when I was hospitalized and they couldn't figure out what was going on with me. And so they just took me off everything and rebooted me with some biologics. And then I got to go see a dermatologist in Sioux Falls, South Dakota. And what a godsend he was. He was my dermatologist for 20 years and he's retired now. But I do have a new dermatologist, same place. So I don't have to keep going through all the, when you have to change doctors, a lot of times you got to go through everything all over again. I didn't have to do that, fortunately for me.
I would love to ask you a couple questions about what you just described for us. And I think first and foremost, you have a unique perspective because you have this disease that certainly has been mild at times, maybe better controlled and uncontrolled. Do you have any sort of sense, any sort of an aura or an understanding that, ooh, I think I'm about to flare?
Oh yes. Oh yeah, yeah, yeah. I've done this. I've been with this condition for over 45 years. I can tell when a flare's coming just by the way my skin reacts. For me, it starts with an itch, and then of course, you got to scratch it, and then it turns into what looks like a pimple, and then it starts to get red and sore, and then that pustule will crack, and then when that cracks, it kind of bleeds a little bit, it dries up, and then that crack. I like to explain it like so people can understand what it feels like. Imagine a paper cut times 10,000, and that's all over your whole body. Because with generalized pustular psoriasis, you just don't, it's not an elbow or a knee issue here. This is the entire body gets covered. And it's excruciating. It's painful. It looks terrible. Uh, it's messy. And without certain drugs, it never gets better.
Yeah, for sure. You mentioned that you had seen several dermatology providers. Can you give us a little bit of an understanding as a patient with an inflammatory skin disease? What is it that a provider can do to really establish a good working relationship? Is it all about the knowledge that they have to be able to affirmatively diagnose you? Or are there other things that we might be able to kind of tease and comb out of that relationship that works well?
Uh, for me, a provider for me has to be they have to be genuine. They have to be able to listen to me because I've been on this journey for a long, long time, and there's probably quite a few people out there that are the same way. We know our body. We know what's going on. I know how to control flares. I know when a flare's coming. So when I go to a dermatologist, I want to be able to talk to them and then tell them what I know and what goes on with me during my time so that they can understand that and then take their knowledge and apply it to what I've told them and then give me the best results out of that.
Absolutely. In throughout this whole 45-year course, which I can't even fathom, can you tell us about some lifestyle modifications that you needed to make that maybe improved, or maybe some lifestyle modifications that you just really didn't think were beneficial at all?
The ones that have helped me out is when I get really bad flares, I like to wear um, all cotton, loose fitting clothing. It's for me, it's imperative that I have that because otherwise I'm just completely miserable, and it's terrible. Um, Something that I've tried that hasn't worked. Oh, all kinds of stuff. I've tried Murphy's oil soap. The stuff that you use to polish furniture with. I was told that works good. For about a month or two, it knocked it down a little bit, but then it didn't. Then it didn't do anything. I've also tried a drug or a medication called it was called Skin Cap, and what it was capsaicin in a spray bottle, which is like the ingredients into hot peppers. And of course, the big mistake I made was I thought it was going to work, so I sprayed it all over my whole body, and it didn't work at all. It turned out to
Yikes.
be a big mess, and it inflamed everything, and it went wild after that.
So you mentioned that you'd been to see multiple dermatology providers, various professionals. You certainly have compounded in your history that you live in kind of a rural area, and you had to travel to see a dermatology professional. Unlike my city of Cincinnati, where we have a multitude. So tell us. What made you continue to seek out? Tell me about that drive, just to seek out other dermatology professionals in your case?
Well, For me, it was because I wanted this gone. I want it to be done. I've had it for so long that I'm tired of it. I don't want it. And, so I went from dermatologist to dermatologist. And for the most part, until I got to the dermatologist in 2005, for the most part, the dermatologist just wrote me a script for a topical and said, here, take this home, try this. If it doesn't work, come back in 2 weeks. Well,
Can I
you
stop
know,
you right there? That is, I want to hit at that, because I think that happens a lot. And you describe for us how you had disease on pretty much every orifice of your body, and someone is giving you a cream. Tell us
oh,
what that feels like.
um, defeated, um, not listened to, um, uh, just all around. You feel like nobody's listening, nobody cares. You can't to prescribe 7 different creams for somebody to put all over his body, and don't forget now these aren't $3 creams. These are $100 creams, $600 creams. I've had a tube of medicine that was $1,000, and I
Yeah.
don't have any insurance.
Oh my goodness.
Yeah, I
Okay.
never had any insurance through
Yeah.
all my through 90% of my journey. I never had insurance.
So tell us about that moment where you interacted with a dermatologist who was able to give you a firm diagnosis. Did you believe that dermatologist? What tell us about that moment and what was your response?
Well, I that was the dermatologist in 2005, and initially, I I actually came home and I looked it up. Not that I don't trust him. I mean, but I like to do a little of my own research just to know what I'm talking about sometimes, and find out what I got, and what if there's something else out there that I can do to take care of it by myself. You know, but when he told me that this is what it was, it made complete sense to me. I could never figure out why I had these pimples. Why are these pimples all over my chest and my back and my legs and my arms, and then it turned into the sores, and then why. Now when I went to him and he explained to me that it was pustules, and they have palmar plantar and general pustular psoriasis, and I was lucky enough to have both.
I'm so impressed with your tenacity. Can you help us with sort of I don't know if you've ever thought about this before, but how many times have you been misdiagnosed and how did that feel?
Oh, I'm going to say I've had pustular psoriasis probably most of my life, and I wasn't diagnosed till 2005. So to me, it was just it was just going to the doctor's office to get a band-aid to put on a gaping gash. It was useless. I mean, it did absolutely nothing for me. It 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 didn't clear anything up ever. I mean, it may have tamed it down just a hair, but it never ever took it away, ever, ever, until I got onto other medications.
You mentioned in our earlier discussion that you didn't do a good job taking care of yourself before or prior to your diagnosis of GPP. What kind of conversations did you have with your dermatology provider that got you to quit smoking and drinking?
Uh, for me, what got me to quit drinking and smoking was I came to a new dermatologist, and I went in and I had a severe, severe breakout. And he told me he wanted to put me on a drug called methotrexate. Well, after he told me that, he told me that if I drank alcohol with taking methotrexate, that my liver would get hard and I would die. So I decided that I would rather have a liver than a drink. So I gave up alcohol and have not had a drop since.
And how
And the
about
smoking, and I quit right after that. I also quit smoking too. So I haven't smoked or drank for over 20 years.
It's incredible. Just your tenacity in all of this. So I want to end our conversation kind of getting at this relationship with healthcare providers. You, as a patient, have such a unique perspective, aside from the fact that you have a rare disease. Help us understand, what can we do as providers that can really, really align ourselves with you as a patient? Is there any sort of verbiage? Is there any specific thing that really, really means a lot to you as a patient?
As long as you have compassion for us and understand what try to understand what we're going through. I know you don't have the condition, but just imagine what it would be like to live with the condition that we live with every day. If you can imagine that, your I believe that their compassion would be a little bit more, and have time for us also. You know, the more time you can spend with us, the more we can get off our chest, the more it feels like you're actually listening to us, and you care for us, and you want to help us. To me, that's huge, 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 huge. um just listen.
It's great, great information. So you heard it here today. Ladies and gentlemen, that our patients want us to spend time with them, that they want us to listen, and that we need to learn from our patients about what their course has been. Please stay tuned for the second part of this activity, where another dermatology nurse practitioner and patient with generalized pustular psoriasis will talk about the impact of this disease on their overall quality of life.
Hello, my name is Stephanie Zimmerman. I'm a dermatology nurse practitioner down in Naples, Florida, and I work at River Chase Dermatology and Cosmetic Surgery. I'm happy to be joined today by Haley Pond, who's lived with generalized pustular psoriasis for more than a decade. In the second part of this activity, we'll be talking about the many ways that GPP impacts patient quality of life. Thanks for joining me today, Haley.
Thanks for having me.
All right. So kind of taking a dive here into some of the history and what you've been through with suffering from GPP over the years. Can you tell us a little bit about your medical history, like when you started to feel like something might be going on, or what you first started to notice and pick up on was happening to your body?
Yeah, I had on my lower back like a patch probably when I was about 19, just like, but it was so small that I didn't really it was just an itchy patch, and I didn't really think that it was anything major. When I got, older, I mean, it was always consistently there. And then when I got older, it, it probably right around, I would say, 26 is whenever I started to know. I'm 37. Is whenever I started to notice kind of just like feeling more fatigued. And then after the death of a family member, I was under a lot of stress, and that's when it flared for my first flare, which was pretty pretty dramatic because I thought I had pustules just form, that weren't any, not even on that patch, just all over the bottom of my feet and my ankles is where it started, and then it kind of worked its way up my trunk, and um, the with it was a lot of depression and fatigue and fever, chills. It was kind of just like having the flu for like 4 or 5 months straight. I mean, my first flare, but then they progressively got worse. Um, so I would say I probably had a flare every 4 months after that until I started dieting and I don't know, just trying to live really healthy, but I wouldn't say that absolutely combats it, you know.
Wow, that sounds pretty terrible. When do you feel like your condition has been at its worst?
Um, that would be like right when quarantine started, pre-quarantine. I don't know if it was discussed or not, but it went all over me. You know, that was the worst that it's absolutely ever been. So about 4 years ago, um, it was I mean, it was all over my head.
Mm,
And my ears would swell, like they would like look like they were inflated and just completely red and purple. It felt like I had like bugs inside my head, in my ears. Um,
I know.
and then and my eyes, like right in the corner of my eyes, and all here I would get little pustules, and I'd wake up and my eyes, one of my eyes would be like, you know, crusted, swollen shut just from not, you know, from wiping my eyes, from itching when I'm asleep. And
Mm,
it got in my nasal passages, so that's when it got really. Um, that's when I knew I had to go to the hospital because I was also having heart palpitations, which is, I would say, another one of the worst parts of it because you know, you're already in pain and then you have
mhm,
fever and you look like, you know, you don't re- you don't really know what to do, especially because I live alone. So during quarantine, I would just sit in cold baths and try to calm my nerves. But yeah, it would it would it causes a lot of brain fog for me. Also,
mm,
I didn't I couldn't do things that I normally did, and if I got out of bed, my muscles in my legs when I first wake up, it was like I just ran like you know,
mm.
the New York Marathon. That's what it felt like I'd like fall on the floor because my muscles and joints would lock up and just be so weak.
And
It,
I think where what you're talking about kind of goes into the next question I was going to ask you, which is, what are some of the what we call like invisible ways that your disease it impacts you that, people may see the rash on the outside, but what happens to you on the inside and how you feel? How does this condition impact you in your day-to-day life?
yeah, so it's I you know I've had I've always been a pretty like up person and very energetic before my first like big plan. I was my late 20s or yeah, late 20s, and it it made it to where I couldn't be around people. I had turned agoraphobic. I was extremely depressed. I mean, it was like everyone in my family had died or something like, and I noticed that it was mostly in the morning, like, you know, from when I woke up to, you know, then being creative, trying to combat it, and like get out of bed, don't watch TV or the news, like go walk around the block. Like, I think just getting my blood flowing is really the only thing that ever kind of helped with the depression aspect because I've never been on any antidepressants.
Yeah.
But the invisible one is also the anxiety. Um, and then you say, like, whenever you feel really sick, that, you know, you have GPP, people ask you, oh, what does that stand for? You say psoriasis. They're like, oh, I have psoriasis on my elbow. And it's like, no,
No.
not like that. You know, I mean, it's just a way more aggressive form. And so, yeah, it just makes you feel really lonely and hopeless. And then as a woman, knowing that the years that you're supposed to be like, okay, this is me, you know, 40 to 60, and I've figured it out, and, you know, I'm a confident woman, and it's like, I already know that those years are going to be probably very, you know, hopefully not, but that they're
Yeah.
going to have a big impact on me even more so. So that is
Yeah.
really scary. The anxiety of it, just knowing that you're all like it's always gonna be there, you know.
Yeah, as people talk about, it's when's the next recurrence sometimes creates such an anxiety. So, when I hear you talk, it's not just the skin, it's not just the pain and the systemic symptoms, but it's also how it impacts you mentally with the fear and the sadness. Haley, tell me how you would describe generalized pustular psoriasis to your friends or family.
Um, I would tell them that, it was an autoimmune disease that is um, going to going to affect me, years later, and also that I was scared, and that and I hope that they would help me if I get really sick. I mean, I did try to make that like everyone in my family knows, like if I get sick, like it's like okay, Haley's coming back to Texas, and we're gonna care for her just because I don't know how bad it's gonna get, and it's really frustrating to them mentally because I'm so up and down emotionally, and they're not used to that. I was kind of always like the one everyone could talk to, and like the pillar in the family out of the six of us, and it definitely changed that. So, um, but on the pain level, they it's torture for them too, because I'll call them and my head's swollen, and my ears, and I'll video chat, and they're like, "Oh my God, like you look crazy," and they want me to go straight to the ER, but I know like the ER is not going to be able to do anything. So it's scary for them, and they they're learning how to deal with it just as I am. You know, doing
Yeah.
it together.
And I think it's a beautiful way to say it, that you're in it together, right? Because this doesn't just impact you, it's your loved ones too. So,
Yeah, it took a
yeah.
while for them to understand how serious it was.
Yeah.
Because psoriasis is a very common word in like medical or just like society.
Yeah.
Everybody knows what psoriasis is or eczema, but it's different this type.
If if you could ask for help from the medical community in a way that you don't currently get it, what would that be? What would that look like? How could we do better to help you?
Um, I would say that um, so the like I don't want to go on to like an antidepressant drug, like I really don't. I want I would want something that was going to make me better and not change, I don't know, the chemical function in my brain. But I guess that's what it is. So it's like I would just want more help with the mental aspect, honestly. And that's hard to find because they just, give you a therapist, or the therapist that tries to get you on antidepressants. And I would like to just, I don't know, I wish there was just a way to go around that, you know, like a healthier way to get my mind feeling like it used to, so I didn't have the brain, like the brain fog and agoraphobia and anxiety and just kind of depression. Like as soon as you wake up, it's like you just kind of have to fight your day through, you know.
Mhm. So, Haley, what would be some of the advice you would have for clinicians like myself? I'm a nurse practitioner, or physician's assistants who would be watching this segment today in terms of how we could better support you or help you, and just understand overall what you're going through. What could you teach us and how we could do better to serve you?
Well, um, just really listening, I think, is a big part. I had, I any of because I have Medi-Cal, so any of like the physicians that I'm assigned to, it's not one that I picked. You know what I mean? And and usually they're really busy. It's really hard to get an appointment, and um, but just like really listening. I feel like I haven't any doctor that I had. I didn't. They didn't. They have their schedules and they're busy and they have 50 other cases that day, but when you go there and you're feeling really sick and hopeless, and then they're kind of like, oh, okay, well that yeah, that goes in line with this disease, and just really, I guess, listening and also fighting for more, I don't know, more research into it, because there's not, I think there's not even an FDA drug that's approved, like, in the United States strictly for DPP. So, um, I just, yeah, just trying to figure out how to get us better in some way or more livable, life in the future.
It's great
So
advice.
yeah, listening and also just research because I don't want to get worse. I really can't imagine it, you know.
Yeah. The great news is there's things that are out there. So, there's things ahead for you. So just to have some hope and faith in that. Okay.
Yeah.
Thank you for watching today. To receive ANCC credit hours for this activity, please complete the short post-test and evaluation. Keep an eye out for further DNA educational activities in the near future.